look after the patients who are suffering from hormone related problems. So today we will be talking about adrenal insufficiency or hypercortisolism. So there are mainly two types of adrenal insufficiency: the primary adrenal insufficiency and the secondary adrenal insufficiency. So we will be focusing on secondary adrenal insufficiency today. So when we have the secondary adrenal insufficiency, it is mainly affecting a hormone called cortisol. So cortisol is body's natural steroid, which is produced by our adrenal gland. So which helps us to maintain our blood pressure, our blood glucose levels, help us to suppress the inflammations and help us to cope with any stress that happens in our everyday life. So cortisol is actually diurnal, or it works daily. So we can see the highest levels of the cortisols in our blood shortly after waking, with nearly they are undetectable when we deeply asleep. So this surge in the morning is very normal and it is healthy, which help us to feel awake, alert, and ready to start our day. So by the end of the day, the cortisol level will decline and they are undetectable. That's when we feel sleepier at night. So the normal cortisol levels, this is a reference range from 6 a.m. to 2 a.m. They are between 133 and 537 nanomole per liter. So this is a visual of how the cortisol rhythm looks like throughout the day. As we saw previously, the highest levels we can see soon after waking, and it is in the morning, and it gradually undetectable during the night when we sleep, and it will start again back to normal, back to action the next day morning. So next we are going to watch a video which explains what is HPA axis. So in this video you will see the organs which are involved and how they work.
Welcome to 2-Minute Neuroscience, where I explain neuroscience topics in 2 minutes or less. In this installment, I'll discuss the HPA axis. The hypothalamic pituitary adrenal, or HPA, axis is best known for its role in our body's reaction to stress. The HPA axis includes a group of hormone-secreting glands from the nervous and endocrine systems: the hypothalamus, pituitary gland, and adrenal glands. The hypothalamus is a small neuroendocrine structure situated just above the brainstem that controls the release of hormones from the pituitary gland, a hormone-secreting gland that sits just below the hypothalamus. The pituitary gland can release hormones into the bloodstream to reach a variety of targets. In the case of the HPA axis, hormones released from the pituitary gland travel down to the kidneys and influence the secretion of hormones from endocrine glands called the adrenal glands, which sit on top of the kidneys. The primary function of the HPA axis is to regulate the stress response. When we experience something stressful, the hypothalamus releases a hormone called corticotropin-releasing hormone, or CRH. CRH signals the pituitary gland to secrete a hormone called adrenocorticotropic hormone, or ACTH, into the bloodstream. ACTH travels down to the adrenal glands, where it prompts the release of a hormone called cortisol from the cortex, or outer layer of the adrenal glands. The release of cortisol causes a number of changes that help the body to deal with stress. For example, it helps to mobilize energy like glucose, so the body has enough energy to cope with a prolonged stressor. When cortisol levels in the blood get high, this is sensed by receptors in areas of the brain like the hypothalamus and hippocampus, which leads to the shutting off of the stress response through what is known as a negative feedback mechanism.
So yeah, as I said in the beginning, adrenal insufficiency, there are two types: primary adrenal insufficiency or Addison's disease, and secondary adrenal insufficiency. So the secondary adrenal insufficiency is often caused by exogenous steroids or any impairment to the pituitary gland resulting in a lack of ACTH production. So exogenous steroids are the steroids we use externally to our body to treat any other conditions. For example, we use steroid inhalers to treat asthma. We use steroid creams or ointments to treat skin conditions like eczema. Sometimes steroid tablets we use for conditions like rheumatoid arthritis. So when you are on a steroid preparation for more than a few weeks, your adrenal glands decrease the cortisol production. So when there is an abrupt withdrawal of the exogenous steroids, you will feel some symptoms because of the low steroid or cortisol levels in our body. So a gradual reduction in the dosage gives your adrenal glands enough time to resume their usual function. So when you have a low steroid level or cortisol level in your body, you may experience an unexplained tiredness, weight loss. Sometimes you may feel dizzy or faint, depression, aches in the joints, muscles, and abdomen, nausea, vomiting, or diarrhea. So if you feel these symptoms, and if your steroid is being taken off from you abruptly, these symptoms could be because of insufficient cortisol levels in your body. So what your medical professional, we check the cortisol levels in the body, but a one-off measurement of the blood cortisol is not accurate enough to diagnose adrenal insufficiency. As we said earlier, it is diurnal, so that the readings can vary from time to time in normal people. So we do a test called a short synaptin test. For that, when somebody is on a long-term high-dose steroids, what we do is, if you need to do the test, we try to wean them down to a standard dose of the steroid first, and then we ask the patients to come in our daycare centers where we do a special test called the short synaptin test. So when you come for the test on the morning, you should not take your steroid dose for that morning. And also, if you are on a prednisolone tablet, there should be a 24-hour gap between the blood test and the last dose of the prednisolone tablet. So when you come in the center in the morning, at 9 o'clock in the morning, we take a blood sample, that is the baseline cortisol level. And then we give you an intravenous injection of a synthetic ACTH. Again, ACTH is a hormone produced by the pituitary gland, which stimulates the adrenal gland to produce the cortisol. So we artificially, try to stimulate your adrenal glands. So we give you the intravenous injection of synaptin or the synthetic ACTH. And after half an hour time, we repeat your blood test again for the cortisol levels. So if the adrenal glands are working properly, they should respond to this synthetic ACTH. So if they are not doing that, means then we will have the diagnosis of adrenal insufficiency. So as we saw in the video, when you have a lot of cortisol in your blood, in your body, when body detects that, it is kind of switching off the adrenal glands to produce the cortisol levels. That's why we have low cortisol in the blood. So for the treatment, the standard glucocorticoid replacement therapy is the hydrocortisone tablet. So the standard dose of the hydrocortisone tablet is 10 milligram in the morning, 5 milligram at lunchtime, and a 5 milligram in the evening. So, so as we said initially, when somebody gets up, normal people, when they get up in the morning, they will have enough cortisol in their body to start their day. But somebody with adrenal insufficiency, they won't have that enough cortisol in their body. So we need to replace them. So hydrocortisone 10 milligram tablet, the morning dose, we can take it soon after getting up with a sip of water. You don't have to wait to eat your food. It can take in empty stomach, because we are replacing something. We are not giving anything extra to the body. So that dose in the morning will help you to start your day. And you can take your second dose around, if for example, if you take this morning dose around 7 o'clock in the morning, you can take the second dose 5 hours after the first dose, that is around 12 o'clock at lunchtime. And the last dose should be taken not later than 6 p.m. Again, it's a the cortisol levels is nearly undetectable by 9 p.m., 10 p.m. in the night. So that's when we go to bed. So if you take the tablet late, then it will disturb your sleep. So that's why we advise our patients to take the last dose, not later than 6 p.m. And the some patients, they do complain, tell us, like, when they take the morning dose, some patients, they don't know, they take the tablet after the morning breakfast and all, so they feel dizzy, very tired in the morning when they get up. So this is the advice, is to take the morning dose the first thing in the morning, soon after you get up. So next, we are going to talk about the steroid emergency card and the bracelets. If you have a permanent diagnosis of a secondary adrenal insufficiency, your specialist team will ask you to carry a steroid emergency card. So with the details of your personal details, as well as the details of the medication you take. So in that card, it has all the details, in the card for the medical personnel who is attending you, explaining them what to do when you have some, when you have an adrenal crisis. Also, there are bracelets or necklaces are available to buy online, stating that you are receiving steroid replacements with your emergency contact details. Sometimes, if you don't have permanent, diagnosis of adrenal insufficiency, your specialist team will ask you to carry a different card, which is the blue card, which states your details and the dose of the steroid medication you are on. Next is steroid sick day rule. So if you've been advised to follow, this is what we need to follow when you have a sick day. For example, if you have a mild illness such as a head cold with little or no fever, then you should not do anything in the dose of the tablet. Otherwise, if you have a fever on a day, then you should double the dose of the hydrocortisone tablet. And then we advise people to double the dose for the first 48 to 72 hours for that time of intercurrent illness. But the thing you should make sure is you need to seek medical help for that intercurrent illness, because this steroid tablet, it will not help you to, by doubling the dose, it will not help you to treat that intercurrent illness. So once you feel okay, or after 48 to 72 hours, you can be back to your normal dose. Also, the other thing you need to keep in your mind is, if you are having any surgical procedures, including any dental procedures, always you will need an extra steroid cover. It is always important you should show your steroid card to the medical professional who is caring you. They should know that you are on a steroid replacement. So if you are having a surgical procedure where you need a general anesthesia, then you will need an intravenous or intramuscular dose of hydrocortisone as an injection. So next is about a day when, if you have an undue emotional stress, for example, if you are attending a test, or if you are giving a speech, or any particular special days, if you are having any undue emotional stress, you will need to double the dose of the steroid on that particular day. Again, next is about adrenal crisis. It is a life-threatening emergency, so you should not delay in obtaining medical assistance if you become very unwell. So if you become seriously ill, especially with vomiting and diarrhea, and if you are unable to keep your tablets down, or the diarrhea won't, in the case of diarrhea, the tablet won't be absorbed properly. If that is the case, you will need to have an emergency steroid injection. If you have been advised to keep an emergency steroid injection at home, you can keep the injection at home, and you will be taught how to take the injection by the specialist team who is looking after you. If you are not being advised to do that, but if you have any symptoms like diarrhea, vomiting, dizziness, any confusions, anything like that, you will need to seek emergency medical help by ringing 999, and you need to let them know that you are on steroid replacement. So even after having the injection at home, you will still need to seek medical help, because you will need to have extra intravenous fluids in the nearest hospital. Here also, I actually have a video with me to share with you.
When we are under stress, our body is designed to release.
Yeah.
Thank
However,
you.
people with adrenal insufficiency are not able to do this, resulting in adrenal crisis. Adrenal crisis is one of the most common endocrine emergencies which may lead to severe illness or death. It is commonly triggered by vomiting, upset stomach, dehydration, especially during fasting, infection, and severe physical injury. Warning signs of an adrenal crisis include nausea, fever, headache, dizziness, drowsiness, or confusion. So what should you do when you have these warning signs? Firstly, inject yourself with hydrocortisone on the thighs or the deltoid muscle to provide that additional steroid you need. After that, call an ambulance and go to the hospital. Remember to show the medical practitioner your steroid emergency card. What can I do to prevent an adrenal crisis? Firstly, take your medication every day at the right time of day. Secondly, take extra medication whenever you're sick or injured, as advised by your doctor. Thirdly, keep the following items on you at all times. Steroid alert card. This card identifies you as steroid dependent. At the back of the card, there is information on what to do during an adrenal crisis. Additionally, you may also wear a medical jewelry with details of your medical condition. Hydrocortisone tablets. Always bring extra tablets to cover increased doses if you become unwell. Emergency injection kit in cases of emergencies. With this information, you should be able to reduce your risk and react appropriately to an adrenal crisis. For more information, please visit the ADSHG website. Thank you for watching. If you missed any of our previous videos, please watch them using the links in the description below.
So I think that's all today to talk about the adrenal insufficiency and how to manage, about the sick day rules and the adrenal crisis. And if you have any questions, we can now